if I were to compare the experience that I had with the last practitioner that I saw, it was really different in the sense that I don't think that as much time was spent telling me about the... I'm the kind of person that wants to know what exactly is going on, particularly since I've had a bad experience with it. But to be able to have a discussion with me, what helped me was to have a discussion with me, just like you were just speaking of, about all those canals. And that's just how... I benefit from hearing that. It gives me a picture of what's going on inside of my body, as if I were looking at an X-ray and you were telling me that I have a broken bone and this is what you're going to do with it, and you're going to put a plate in here, you're going to put a screw in here. To have that kind of information, first of all, is really calming, but the fact that you would take the time to do that, because I don't think that was my other experience. It was a little bit of it, but not much. And so as I went along and I didn't get any kind of, I wasn't getting the relief I was seeking, I would ask about it and I wouldn't really get an answer. What I thought was helpful from the way that you did the treatment with me is that you did this gathering of information from me, and then processing it and interpreting it back to me and telling me what it was exactly that was going on and the treatment that I needed. And you were patient enough to listen to all those symptoms as if it was not a problem to hear all that, but that was part of the visit. So that would help you to help me, or just the fact that I could share that with you. That was different. When you did the maneuvers for this particular problem, you did them differently. I felt like you handled me differently, and I noticed that right away. And I thought, okay, now we're going somewhere. That's just what came into my head. Now we're going to go somewhere. Something's going to happen, because this seems to be different. Something happened when you took my head off the table off the right and took my head off. It was different, the way that you handled my body. And then, of course, I got... Shall I talk about the reaction I had on that visit?
Yes.
So I got sick. And... that didn't happen on the other visits. And I knew that could happen because the other therapist had said someone had been sick with her that day. So I knew it was something that could happen. But somewhere in my mind, I was thinking, I need to get... this has triggered something, the start of a healing process, and my body is responding. And so it took me a couple of days to get over that.
It does. Commonly.
Just not fun. And I chose to sleep sitting up because I thought that would make me feel better. But I could tell that things were starting to shift. And then this last time that you've worked on me 2 times, right? Just two visits? Were 2 actual...
It was 2 actual visits with treatment. And then the 3rd visit was testing to make sure that it was gone. And then I gave you exercises. And then actually a lot of it was getting back to the things that you want to be able to do, because we also know that people continue to avoid everyday life, things that they want to be able to do, even after the vertigo is successfully gone. But when every time you try to do yoga, or you try to bend down and pick something up, or every time you try to lie flat on your back, the room spins, or you get incredibly dizzy, or you get sick, have that happen for 6 or 7 months, and then all of a sudden be told by somebody, oh no, it's fine now. That's a very hard sell for people oftentimes. And we see that a lot. So